The North Carolina Governor's Working Group on Veterans, Service Members, and Their Families has deep roots in the Tar Heel State going back more than a decade. Today, it offers a home for the dozens of groups in the state focused on improving veterans' lives and provides a canopy of relief for hundreds of thousands of North Carolina vets. The GWG is a living, breathing apparatus of service, providing a space for veteran advocates to find new ways to better serve those who have served our country. The first seed of this awesome idea was planted in 2006 among the founders Flo Stein, Dr. Harold Cudler, Dr. Wei Li Fang, and Dr. Mike Lancaster. Over the next few years, the roots of what we now know as the GWG began to take hold, and by the early 2010s that seed had grown into a sturdy sapling. Heavy-hitting state agencies such as the Department of Health and Human Services and the Department of Commerce had come on board. The Department of Veterans Affairs was fully engaged, and nonprofit groups from across the state were getting to know each other, meeting, and finding ways to work together to make veterans' lives better. In 2013, NC for Military Employment was created, NC for Me, an offshoot of the Department of Commerce. In 2014, the organization officially became a working group, before it had been a focus group, and a number of today's mainstay service providers got their start, among them Operation Home, a group committed to ending veteran homelessness, NC Strive, which helps address veterans' educational needs. Also, the first Women's Veterans Summit and Expo was held in 2014, and Veterans Experience Action Centers were established around the state. The following year, another group that's now indispensable was born out of the GWG, NC Serves, which today serves more than 13,000 veterans in 80 North Carolina counties. Also in 2015, the state doubled down on its commitment to vets, creating the Department of Military and Veterans Affairs, which promptly joined the GWG. A large part of the group's success can be traced to its unwavering commitment to key veteran issues, like curbing veteran suicide and ending veteran homelessness. Those critical missions were at the core of the seed planted in 2006 and remain central today. In 2012 and again in 2015, the group published statewide suicide reduction and prevention plans.
These are a lot of good guys, but if they're sitting at home, kind of...
Over the past 3 years, the GWG has become a showcase for veteran-oriented videos and digital media outreach.
I am sober.
Including an original series called Words to Live By. Battle-hardened veterans speaking directly to other vets, encouraging strength and resilience. Today, the GWG meets once a month to highlight pressing veteran issues, explore new solutions to veteran problems and challenges, and build relationships that turn ideas into action. Representatives from dozens of groups across the state make the monthly trek to Raleigh for the 2-hour meeting. Many more watch online. Each meeting is streamed live, offers closed captioning, and allows for viewer engagement. New ideas like the Governor's Challenge are introduced and given space to grow. Ideas like helpncvets.org are showcased and offered up to the group. Help NC Vets does just what it says, helps veterans and their families get connected to services in the state and connect with each other. Because of these and other efforts, veteran homelessness has turned a corner over the past decade. The veteran suicide rate in North Carolina is significantly lower than the national veteran suicide rate, and the Tar Heel State has boasted one of the lowest veteran suicide rates in the Southeast for the past several years. From its humble, passionate beginnings, the GWG has grown into a mighty tree of veteran support, and it's only getting stronger. Every year, the ground in which it's rooted gets richer and its branches grow longer. New fruits of service spring up, and more relief finds its way to North Carolina veterans and their families. The North Carolina Governor's Working Group can and should be a model for how to meet that mission around the country.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good afternoon, everyone. My name is Jeff Smith, and I'm the Military and Veterans Program Liaison for the North Carolina Department of Health and Human Services. I am filling in for Crystal Miller this afternoon. She had some stuff run long, so I will do my very best to fill her shoes, so to speak. Thank you for joining us for the North Carolina Governor's Working Group. This is our 15th year. You can register for our email updates at ncgwg.org. Or you can join us live stream at facebook.com/govinst, GOVINST. Many of you are watching us there. Closed captioning is also available at Carolina's Captionings, and the meeting and agenda updates are always available at NCGWG after we have completed. It is my honor to introduce General Walter Gaskin, our Secretary of Military and Veterans Affairs. Good afternoon, sir.
Well, Jeff, thank you for that introduction, but Secretary Gaskin is on another meeting downstairs with the congressional delegation in DC, so he sends his regrets for not being here. He wanted to speak and just say hello, but I think the folks downstairs have called him into other meetings. But yeah, Secretary Gaskin he's all on board with what we're doing here. He thinks it's great work, and he will be available. I promise you. Right now, he's been drinking from the fire hose for about 6 weeks now, and we look for his confirmation and swearing in. Well, his swearing in is on next Tuesday, and then his confirmation. And once that occurs, then he's got it full-fledged, no problem, and no backing out. It's all steam ahead. But, you know, as I mentioned earlier, he is friends with those folks in Washington, D.C., personal friends with the Secretary of Defense and also the Secretary of the VA. And he is fully engaged, in touch with it on both sides of the house, on our military side and on our veteran side. So with that, I know on behalf of Secretary Gaskin, thank you, welcome, and thank you for the great job that you're doing for the state of North Carolina on our veterans and military, both on that level. Next slide, I will go on and say what's happening now. Well, we continue working in a remote environment to deliver the veteran services that's out there. Hopefully, things are starting to relax a little bit, and we're going to open up some more as those vaccinations come online. You know, we will get to that point where we can do that. And with that, our state veterans homes, we have conducted 2 of the inoculations there, and we've got a 3rd one scheduled, I think, this week and next week. So that will get the biggest part of our residents in our homes. And I think right now we're sitting at about 90% of those residents have been vaccinated or more. And we're also, we found something out that the military installations, they report directly through their channels, which don't go through through North Carolina. So the numbers are going to be greater because I think the VA and the military installations, once we get those numbers, that number in the state will definitely increase tremendously. And just as a sidebar, I go for my 2nd shot this weekend at Durham VA Center. So thank you very much for that one, Leanne. And also Secretary will get his 2nd one on Sunday. So that's a good deal. We were looking too at, you know, talking about the military and the families and the veterans and the families. And, you know, the question the Secretary brings up is, well, if we're giving a veteran shot, why are we not giving his caregiver, the spouse, their shot as well? And same thing on military installations. So, you know, we're kind of tracking that down. And I know I think that might be one of the things he's talking about right now. So more to follow on that. We're tracking the House and Senate bills on the tax exemptions. We're in a daily conversation with the General Assembly over there on issues of veterans and military as well. So that's kind of what we're doing. And we're also developing our budget for the 2-year budget cycle for the 21-23 budget cycle. So next slide. And what's coming up next? The Secretary is planning on visiting every military installation in North Carolina, to include Matsu, all of them. And our nursing home in Kernersville, we're ahead of schedule. We look for a completion date sometime around the summer, beginning of summer of 2021, and we will definitely have a scheduled grand opening at that facility. More to follow on that, and we will certainly put that out in on the governor's working group and through our media outlets. So we'll keep everyone informed of that. Very proud of that facility. It's right across from the HCC up there in Kernersville. So that's good, right there at the Novant Healthcare Hospital. Crystal has gotten out the virtual continuing education throughout the county, the state and the county association. We will do that again this year. Our training will be virtual, and we have got lots of training with a lot of volunteers that have stepped up and said, yes, we'll provide training as well, especially with the National Veterans Legal Services in Washington, D.C. So they're providing a lot of our training as well. So, even though we've had a setback, the old American way of business of ingenuity and figuring out how to do it, we've come out ahead of it, and I can only say good things. So out of I guess a tragic situation that we're in, goodness has come out, and we can figure out how to do business in a remote way. And also, I know Blake, I know you're probably on the line there. I'll reach out to you as soon as the fire hose kind of slows down a little bit, and get the Secretary and you together. So with that, my takeaways is we remain in this state, and we have seen goodness, as I've stated. The vaccine, get your vaccination when it's available. Stay vigilant with the 3 W's. Even though you got the vaccination, continue to wear your mask. Can't say enough about that. Help the person that you're talking to. Also, make that person help you by wearing their mask. We'll continue doing our business in a modified delivery method, but we're still doing the business, and business is coming in, and it's coming good. And of course, our Kernersville is nearing completion. So with that said, that's all I have for now. And I thank you all for what you do and for the collaboration here that we've got. And it's good stuff. So thank you very much. Jeff, I'll turn it back.
Thank you so very much, sir. And we will look forward to things slowing down a little bit so we can all get acquainted with General Gaskin.
And a final note, if I may, we're glad to see the great heat tab in the sky shining for the last couple of days. So it's been wonderful. Get out and get some vitamin D in your body.
Excellent point, sir. Excellent point. We are now delighted to introduce Dr. Mary Parker. She's the Acting Chief Medical Officer for VISN 6. Dr. Parker, ma'am.
Good afternoon, everyone. Thank you so much for welcoming me to this outstanding collaborative group today. I'm pleased to bring you greetings on behalf of our Acting Network Director, Ms. Stephanie Young, myself, and the entire team. We do have several key updates. We'll talk first about our new secretary for VA, Mr. Dennis McDonough, who testified as recently as yesterday regarding our COVID vaccine response, along with Dr. Stone, who is our acting undersecretary, and Dr. Jane Kim from the National Centers for Prevention. We continue to move quickly to find him to be engaged. Mr. McDonough is a listener. He is an advocate for veterans, and we are excited to see how engaged he has been in working with us to learn how and why we are making the decisions and working with our teams. So really great news to have him in the seat and moving forward in 2021. The next thing to talk about is veteran debts and overpayments. It's a mouthful all in one line. We, back at the beginning of COVID, as in all situations, we learn how to maneuver, right? This has been our biggest test of resilience that we may have ever experienced. We, as a part of our COVID response, did not send out those bill statements as a part of reducing mail and initial concerns. We have obtained relief for our veterans for the next several months. Individuals are able to contact and find out their specific information if they wish to make a payment. However, we are able to continue that relief through the upcoming months into throughout this summer. We have expanded. I enjoyed my predecessor's comments and agree we are moving quickly to make sure that we are providing vaccines. We have administered over 1 million vaccines in VA. We are moving quickly to reach the 2 million mark. And in testimony yesterday, Dr. Stone indicated that next week, our North Carolina and our Virginia markets will receive a total of 5% of the 180,000 first doses that are being released, which is about where we've been, though the 180 number is almost a third higher than we have received in previous weeks' allocations. The best vaccine is vaccine that's been administered. So I am so pleased to hear of so many of our veterans who have obtained their vaccine doses, both first and second doses, or even just the first dose, and they're coming to see us soon. We'll be grateful to greet them at the door in the next several weekends. And we do have large blitz organizational plans at Durham and our other sites, both this weekend and in Salisbury for veteran events. Caregiver vaccinations have been expanded and are being provided for those who are involved in our caregiver support program. This is a wonderful program that you all are aware we expanded in our beginning of this fiscal year in October to engage additional parties who need assistance. So caregiver support has been such a wonderful program for us. We are working to get those vaccines out, both to our home-based primary care patients, to our caregiver support enrollees, and to those primary and secondary caregivers. So that's been a humongous initiative and one that we are so proud of. Let's talk about testing. It's really nice to have a break, which we'll all hold our breath and knock on wood that's around us and hope that we can continue to see reductions in our positivity rates, both in testing need and also in testing conversions. We have worked within our team across North Carolina and Virginia to make sure that we are well positioned so that we have the most up-to-date and advanced testing opportunities available for our both inpatient and outpatient veterans. There's a series of Hologic Panther devices that are being installed across all 7 facilities. We have 3 that are active, and the final 4 will be going in the next several weeks. We hope by April 1 to have all of those active. Those will increase and enhance our testing and frankly diversify our testing so that we have both our Cepheids available for fast testing and our and then our other point of care or antigen based tests as well. Finally, congratulations to our Fayetteville team. As of Monday, we've received approval. Their urgent care center will be reopened as an emergency department. That coordination is also coinciding with activation of their operating rooms for inpatients at the main Ramsey Street location. And just the Fayetteville team has been working so diligently, and we're grateful for all of their good efforts as they have really worked to enhance the care that we can deliver in that unique community. You've got some vaccine pages there, vaccinate early, vaccinate as soon as possible. I wouldn't be doing my job if I didn't remind folks that we are moving through our vaccines. You hear that I've spoken about that twice, but it's really important, along with the 3 W's. Next slide, please. And so we are excited that our Janssen vaccine may become available. We did participate and have good enrollment in the Janssen trial at our Durham location. We anticipate that we may hear as early as this weekend. The review with the FDA for that product is slated for tomorrow. We can look forward to veteran experience marketing assessments that are coming in the next several months, as well as an absolutely lovely campaign. The I Am Not Invisible campaign is coinciding beautifully this year with our Women's History Month. And as someone who has seen this display, it is so moving and so well done. So I encourage you, if you are at one of our medical centers, you will be able to see various components of that display, and we'll be keeping those around. And finally, we are moving to activate as many services as we are able to in as complete of a fashion as possible. And we have been so fortunate that we have maintained all clinical services, though in a phased approach throughout this COVID pandemic. And so we continue to practice safe socially distancing in our waiting rooms, and we are working to enhance and improve and increase our care in face-to-face as safely and quickly as possible. Though I would be remiss if I did not point out that this has been a wonderful opportunity to demonstrate what an amazing role virtual care and telemedicine care can provide. So with that, I believe that's my last slide. Oh, takeaways. I forgot the takeaways. Please, please, please take a moment, click on that link. There's some amazing information there, and it's just so helpful. We anticipate we will be updating that just as quickly as we get additional approvals. And do not hesitate to reach out to our staff at any point regarding eligibility. We are using modalities to reach out to those who are registered and enrolled so that we get them into their priority groups and we get those vaccinations underway. But with that, thank you again for the opportunity to bend your ear, and please let me know with any questions.
Thank you so very much, Dr. Parker. It's always our pleasure, and thank you for this life-saving information, ma'am.
Thank you, sir. Thank you for the opportunity.
Next, we are honored to welcome back to the group Assistant Director Leanne Skeens Wilson. I believe she's picked up a Wilson along the way, so congratulations to that, ma'am. Would you like to join us?
Yes, thank you so much, Jeff. Good afternoon, everyone. So let me start out with, we already talked about, of course, the new secretary, but for us in the Veterans Benefits Administration, we're still waiting on the appointment of an undersecretary for benefits. We have Mr. Tom Murphy serving in that role as interim undersecretary until we do have a new appointment. Mr. Murphy has served in that role before. He was there during the transition, during the past transition when we were waiting for Mr. Lawrence to be confirmed. So he is very familiar with VBA and actually works as one of our district directors in his regular daytime job. I wanted to talk to you about just a couple of things that are happening on our forefront, one of which is the transition from e-benefits to VA.gov for filing claims. This is a migration away from that e-benefits website in an effort to streamline how veterans get their information from us. So they'll be able to go to just one website as opposed to having to remember multiple ones or navigate through multiple websites. VA.gov, most of the features are already available on that website, although there are a few things still in e-benefits, but that final migration over to VA.gov will be completed at the end of April of this year. And we have been working on getting that information out to everyone through a variety of mediums. Next, I wanted to mention the new Agent Orange presumptive conditions. You may have already heard about these as well. But as on January 1st, the Defense Authorization Act was passed into a law which added 3 new diseases under Agent Orange. Those conditions are bladder cancer, hypothyroidism, and Parkinsonism or Parkinson-like symptoms. So we are working on implementing the change in law to those for those conditions, and we'll be developing the procedures to appropriately process the claims on those. Next slide, please. As a regional office, we are operating in phase 2, which means that we have some people coming into the office and we're available for face-to-face. I'm sorry, I got ahead of myself on the slide. We are open for appointments only, and we are utilizing a wait well system to schedule those appointments. If you need to come in to see us, veterans are able to do that. We are encouraging still the telebenefits approach, and we have a way to talk to veterans virtually through use of a video connect system and can usually help everyone with their issues that way so they don't have to travel down to the regional office at this time. Coming up next for us, our face-to-face outreach unfortunately does still remain postponed. We're very excited about getting back to that when things return back to normal. As you all know, we do a very robust outreach program. And while we have tried to maintain a lot of that and while we're under COVID, I think, you know, there's a lot of missed opportunities without being able to go and see people face-to-face. That said, we've been doing virtual outreach events. We've been doing them about monthly. We're going to back off of those to go to about every other month for now. We're trying to stand up a few more things like telebenefits with some of our partners in VHA. So we're working on some of those. And also while we do this appointment-based system that we have going on while we're in phase 2, we'll be modifying our virtual outreach schedule to about once every other month. So our next opportunity for that is on March 4th, and we'll be talking. And as always, you can visit our regional office webpage for more information about upcoming events or the status, our operating status, what phase we're in, and what that means if we're in phase 2 or phase 3, what that means for you if you're trying to get a hold of us. Next slide. Our takeaways, just to highlight again, the transition from e-benefits to VA.gov, that will be done at the end of April. The new Agent Orange presumptive conditions, we're working on procedures to process those claims, As I mentioned, we're utilizing wait well appointments so that we can continue to provide world-class customer service to our veterans, even though we are in a pandemic situation. Our claims processors have been in max telework. However, that has not decreased the administration of benefits or the quality of our service, as we have found that our claims processors are actually quite productive working from home overall. So the challenges we have currently with our claims are getting the exams, and that is just a product of the pandemic. And once we're able to get back to a more regular schedule of being able of the medical centers and our contract providers to be able to provide those exams, the claims processing will pick up again at that time. So I think that's the end of my slides. I want to thank you all for your time and for having me back. It's nice to be back with you guys again. Thanks, Jeff.
So good to see you, ma'am. You have a wonderful weekend. Thank you.
Thanks.
It is my pleasure. It is my pleasure now to introduce to you Dr. Michelle Laws from the Division of Mental Health. She's Assistant Director for Consumer Services, Support Services, and Community Stakeholder Engagement. And she is the person that makes all of this possible. Dr. Laws, good afternoon, ma'am.
Good afternoon, everyone. Thank you, Jeff. It's a pleasure always to join our partners as we collaborate together and present updates on where we are in the state, helping to serve our military families and our veterans as well from our end of the table. We have exceeded the 10,000 mark of deaths in North Carolina and the 500,000 mark in the nation in terms of deaths related to this COVID virus that will not let go of its grips. Even though we are excited about the vaccines, we're still seeing deaths increase in some areas. But in our state, next slide, I'm glad to see some of the indicators in terms of cases, in terms of hospitalizations. We are so glad to see that begin to trend down. And as a result of that, on yesterday, our governor issued a new Executive Order 195, which lists the modified stay-at-home order that was put in place, which basically put the whole state under a curfew between the hours of 10 p.m. and 5 p.m. That curfew or order is now released, and we're back open. People can move about. The number of people who may gather from indoors has also increased from 10 to 25 people. And the curfew, again, on the sale of alcohol consumption has moved now from 9 p.m. to 11 p.m. Next slide. In more detail, when we think about those gatherings, indoor gatherings, we, as well as outdoor venues, it is still extremely important, even though we're seeing the trend in the right direction, thanks in large part to people practicing the 3 W's, but certainly a lot of credit given to people like our wonderful Deputy Secretary Falls, who's getting in line and getting their shots to be vaccinated against this highly contagious and aggressive virus. And so just unpacking the executive order that the governor issued on yesterday, there's a 30% capacity limit that may not exceed 250 persons indoor. We know that many of our bars and many of our recreational facilities and amusement parks and the like are pleased to see this, because it's time to get the economy moving again. And so it's a small step to many, but it's certainly a step in the right direction. Next slide. And again, in terms of indoor event venues with more than 5,000 seats, they can now go from the 250 up to the 15% capacity. And so that includes restaurants, breweries, wineries, distilleries, fitness and physical activities, pools, museums and aquariums, retailers, outdoor areas of amusement, salons, personal care, and the like. Next slide. The next thing I want to focus on is, again, just, all of the other presenters before me have mentioned the vaccine. Right now in North Carolina, we have distributed or vaccinated over 2 million people. So 2 million doses in the first, total doses, including the first and second doses. We are currently in group 3. This week, we began to vaccinate teachers and child care providers that are serving children in the up through 12th grade. So in the pre-K through 12 school system, as well as daycare providers, child care providers, and teachers and those serving in our public education facilities. We will be opening that up, extending that to all essential workers the second week of March. And that will also include our faith leaders that are pastors that have been identified as essential workers. And so we are trying to move through this pandemic in a very careful and cautious way. And key to that now is making sure that people are getting vaccinated in the order of prioritization based on their risk of exposure and their risk of death. And so we started with the senior population or the 65 plus population because 83% of the deaths in North Carolina from this virus were represented in that age group. Next slide. Our priorities and what's coming up next. So always eager and excited when we, on the DHHS, DMH, DDSAS side of the house, can partner with our veterans serving organizations and institutions that are agencies that are doing great work. And so the homeless veteran stand downs and the COVID vaccinations campaign is something that we are collaborating on together. And I'm really excited about the work that Brandon Wilson is doing, along with Jeff Smith from our team, in helping to make sure that we're taking advantages of opportunities when our veterans come together, and particularly the high risk populations or hard to reach populations such as the homeless population. So there's homeless veteran stand downs. This is the schedule for them throughout the month of March, as well as the month of April. So we hope that you can find your way to support this and support Brandon Wilson and all the work that we're doing. And then the Ask the Question campaign kickoff. We have worked tirelessly. Jeff has worked in particularly on our end to make sure that we are capturing the right kind of data, but that we're capturing all available data that gives us better insight into our veteran population. And so the Ask the Question campaign, I'm sure Jeff will talk a little more, but it's something that we've labored over, and it's thrilling to finally see it come to fruition. And then I think that's it on that. But again, ongoing assessments of where and how we can best serve veterans in our system through NC Serves. But what I really want to do is go to the next slide. Is remind people that running parallel to this COVID pandemic is a mental health and behavioral health crisis. And so the takeaway, one for me, is that I'd like viewers to take away from this presentation today is to continue to practice the 3 W's, washing your hands, wearing a face covering. I've got my little background because it is so important, even as we're waiting to get in line to get vaccinated, still, and even after you get vaccinated, wear your mask, covering your nose and your mouth. And so they're demonstrating the right way to do it. But the 3 W's are important on the public health side of this pandemic. There's also a behavioral health side. And so I'm encouraging everyone who comes in contact with someone who is in need of behavioral health services that are not served through the VA and veteran services. So those veterans that were discharged by dishonorably discharged or other than honorably discharged and the like, send them our way. We want to help serve the ones that are not being served through the regular VA and DMVA service system. And so this is a resource that we want you to share. We've stood up the Hope for NC helpline, 1-855-587-3463. We know there have been substantial increases for the general population including our veterans and including military families and the like. All those that touch those systems that we serve through this platform here and this convening here have been touched in some kind of way by mental health or substance use disorder and condition. And we cannot lose sight or focus of that. And so we are leaning in hard on intentionally as well on making sure that there are resources available to capture people where they are before they fall deep into addiction or into a mental illness. And so those are my takeaways. Glad always, always, always to be with you all.
Thank you so very much, ma'am. It was a pleasure to see you as always. Next, Mr. Victor Glover is going to be covering several spots today. So he has agreed to cede some of his time here to Mr. Thomas Colclaw, who is the Charlotte District Officer for the U.S. Equal Employment Opportunity Commission. And he's got some interesting trainings and teaching that he would like to share with us. Mr. Colclaw, sir.
Thank you, sir. Good afternoon. Again, my name is Tom Kokloff, and I am the District Director for EEOC. And my jurisdiction covers North Carolina, South Carolina, and Virginia. I would like to thank you so much for allowing me to join you today. As Terry stated, I didn't really plan on speaking. I would like to say, as a retired veteran, that I want to thank you for all that you're doing to assist veterans and their families. You may or may not know that the mission of EEOC is to stop and remedy unlawful employment discrimination in the workplace by enforcing federal laws that prohibit employment discrimination. Another mission that I have is outreach and education. And in that mission, it is to look at vulnerable populations, of which veterans fall into that category. As you all are aware, that due to many years of deployment and the conflicts around the world, that we see many veterans now that have disabilities and are covered by the Americans with Disabilities Act. But what we also see at EEOC is many veterans that really don't know their rights or what services that are out there. So I have recently been working with local governments who have also shared similar things with me to do some outreach for veterans and to help them understand not just what their rights are with EEOC, but also to understand the services that those local governments provide, as well as services that exist from organizations such as yourself. One of the things that we recognize is at EEOC, we recognize what our strengths are. My team, they're real good at doing employment discrimination and understanding the Americans with Disabilities Act, but we're not necessarily good with all the things that your VSOs do. That's what they do. And we want to make sure that veterans understand, hey, this is what EEOC does. This is what some of the local government services are. And this is what veteran services officers can tell you about, and those things and places where you can go. So what we're looking for is those subject matter experts that can help us and share their expertise and their knowledge. So one of the things I'm doing is I'm trying to coordinate a 3-part series of outreach looking at veterans groups and sharing that over the next several months. And so that's why I'm here today. And Terry asked me to join, and I do want to thank him. And that's really all I wanted to do today.
Thank you so very much, sir. We will be happy to share any and all information. We also have weekly newsletters and other means. We can also put it up on the website when you get your dates set.
All right.
And I will shamelessly throw in a plug for our finest group project here, the North Carolina Veterans Resource Guide. Please, I think there may be a lot of things in there for you as well, sir.
Thank you so much, sir.
Absolutely. Victor, do you have any save rounds? Would you like me to go quickly through the unemployment compensation, or do you want to cover that later, sir?
I'll cover it later.
All right. Thank you so very much. Then, Alex, if we can jump forward to slide number 31. And I guess next two slides. So updates for Governor's Working Group's initiatives that we've been working on. Obviously, many of you know about Operation Home. We had our weekly or monthly meeting this morning at 10 a.m. discussed a number of things. And that, much like the working group, is a micro working group of people focused on veterans housing programs, working very closely with VA and HUD and our community partners to fill some gaps. As we said, one of the most exciting things we're working on right now with our friends from the Department of Labor and VA, led by Veteran Services of the Carolina, is our homeless veterans vaccination pilot program. So we were blessed to hear that the Johnson & Johnson vaccine is minutes away from being approved. And that single shot vaccine is going to make vaccinating homeless veterans a lot easier and a lot more, a much more positive event. So we're delighted to help Veteran Services of the Carolina with that effort. Next slide, please, ma'am. One of the projects that we've been working on with the folks from Veteran Services of the Carolinas is using mental health dollars to help augment services and fill in gaps for veterans that are severely mentally ill and homeless. And I know if you visit their website, Veteran Services of the Carolinas, there's a wonderful video on there that talks about the HOPE program and all the work that Veteran Services of the Carolinas have been doing across the state to really, really reach out, go under bridges, go in the woods, and find these veterans who need our help more desperately than anyone, and link them up with folks. So please take a second to go visit their website and view that video. Next slide, please, ma'am. NC Strive got underway yesterday afternoon with our first conference. Great folks from Appalachian State University and Cape Fear Community College put on a wonderful event with UNCTV and the Governor's Institute on veterans and transition. Our next event will be March the 30th with NC State and Wake Tech, and that is going to be on student veterans employment. Please stay tuned for these events. Chime in, jump in. They're really well put together. This is our 7th year, and a lot of good information there for educators and student veterans. Next slide, please, ma'am. As Dr. Law has mentioned, we are launching the Ask the Question campaign across the state, and we'll have some more in-depth updates, some really exciting news, I hope, next month about that. We've also got on the right side here is our toolkit for how to put together a veteran suicide prevention working group in your community. Next slide, please, ma'am. We continue in our Governor's Challenge to move forward amongst these areas where we have identified the 3 focus areas this year. We are identifying and screening for risk. That goes to the work we've been doing with psych armor and things like mental health first aid training, promote connectedness and improve care transitions. Many of our social events, even though they are virtual, NC Serves is another means that we do this by linking people together. Also would be these working groups that we produce. Increase lethal maintenance safety. This really means not only getting gun locks to every veteran in the state, but also providing them tools, things like mindfulness and what have you, that allow them to take that 5 to 10 second break when it's so desperately needed at that desperate hour. So we continue to partner with the folks from the Prevent's Office in the White House and Centers for Disease Control and other agencies to push this effort forward. It's a multi-year effort, so we'll keep you updated. All right, and if you, next slide, please. Any questions, any information, if you have a presentation that you would like the working group to see, please reach out to me. Email's very easy. It's jeff.smith@dhhs.nc.gov. And if we can go to the next slide, I'm going to cede my this time to Mr. David Roddenberry. Dave?
Hey, Jeff, can you hear me?
Roger.
Awesome. So, hey, folks, it's great to be here again this month. I'm excited to talk about some NC Serves stuff, so let's jump right into it. We'll go to the next slide, please. Thank you. Overall, in the all-time data since NC Serves launched in 2015, we're continuing to see good, steady growth, both in terms of client volume and requests for services. So The tagline here is that people are using the network. I'll say it again, people are using the network. And that's a beautiful thing. You can see that this nearly comes out to 2.5 service requests per client. And this, those multiple service requests and these co-occurring services, that's the way that we make these lasting solutions, by not only solving the primary issue, but those associated issues up and downstream of that main issue that they're coming to us for. So to lend a little bit of context, at the end of the previous year, we were at about 12,500 clients and about 3,500 services. To me, that's a good year, regardless, and taking into consideration how all of us struggled to adjust to the COVID pandemic and still do. And so I'm pretty proud of that. Next slide, please. Diving more specifically into the December data, we saw 597 individual clients request 1,076 services. So this isn't necessarily only new clients that have never touched the system before, but rather it's more about client volume. It's new clients. It's those who are returning to us, those whose case may have stretched over that calendar month cutoff. But all this to say is that the care coordinators are processing an average of almost 35 service requests per day. That's a lot of impact to a lot of folks. In looking a little bit closer at who we serve, the team over at the Center for Family and Community Engagement at NC State pulled out some really interesting data about how different groups of clients are requesting different types of services. What we found is that there are differences in services in what individual populations are indicating are their service needs. So just looking at the month of December, we see that in December, men were more likely to request housing and shelter than women, but less likely to request food assistance or income support. And women also requested more social enrichment and less employment support. So we'll go to the next slide, please. Last month, you may remember that we discussed the big picture goals for NC Serves in the coming year. One of those was to devote time, talent, and effort to focusing on health equity among vets and promoting awareness of disparities in our communities. And that's a goal that we take very seriously. So understanding that these differences do exist, they are evident in data. We looked at variations in services sought by race and ethnicity. This points to some noticeable differences in population circumstances. The NC State team is working diligently around the clock, researching this as we speak, but we can say with some level of confidence that Black and African American clients are carrying more of the overall numbers in housing and shelter requests than other races. White clients tend to seek out a different set of services, such as benefit navigation and social enrichment. Now, I'm going to intentionally stop short of making any statements about health income or health or income disparities among different populations of race, ethnicity, gender, not for any political reason or position, but because we simply don't have the data right now to make those accurate assumptions. But these are important distinctions to understand when we look at the circumstances under which our client base live and help us to kind of frame and contextualize their experiences in attempting to serve them. One thing I do want to point out in the picture there in the background, in recognition of Black History Month, this is a photo of the 54th Massachusetts Infantry, which was an all-Black infantry regiment activated by the Union Army at the height of the Civil War. The 54th proved their bravery in storming Fort Wagner, South Carolina in July of 1863. The 54th Massachusetts led several white regiments in the assault through darkness and across a marsh with water 4 feet deep. The unit would suffer roughly 42% casualties in clearing the way for other units in the assault, and ultimately a strategic victory that secured key positions along the South Carolina coast. For those that remember the movie Glory, that film way back when in the 90s, in the olden days, that film depicted the 54th Massachusetts. But it was around this time, February 1863, that the 54th was actively recruiting and training Black soldiers, many of whom were escaped slaves or emancipated slaves, to actually turn around and go fight. The platform that they recruited against is just the same as it is today. The concept that an individual, regardless of race, regardless of background, could improve their lives through military service. We call it one of those key social imperatives, right? The key understandings in our society that define and support the all-volunteer force. And it's the understanding that we all have when we raised our right hands, right? That idea that to serve our nation leads to individual growth and opportunity, not to poverty and not to be cast aside. Go to the next slide, please. As always, we encourage any organization and anyone who serves military-connected clients to reach out and become a part of this network. When it comes to connecting people in need with services, the only wrong answer here is inaction. So please reach out to your coordination center if you aren't already in the network. If you are, reach out and talk to your CC about how to use this tool as effectively as possible and how to make it work for you. They're always happy to help. They're super friendly, superhuman individuals, and you will be very pleased. So that's it for me. Thank you very much.
Thank you very much, Dave. Thank you for that insightful information and timely history lesson as well. Hey, before we continue on with the rest of our presentations for the day, I just wanted to take a moment and stop and put this slide up, which is food and nutritional assistance. We've got links for SNAP benefits and a food bank finder. As we saw last summer out of NC Serves, one of the sneaking accompaniments of this pandemic has been food and nutrition insecurity. Record numbers of our neighbors and friends are because of the unemployment and everything else, struggling to feed their families. So please, if you know somebody that's having a hard time, if you're having a hard time, follow up on these links. Next up, I would like to introduce Ms. Kimberly Williams, founder and CEO of NC for Me. We are particularly proud of the work that she has done here in North Carolina, and we'd like to think, at least on one basis, part of NC for Me was born at a governor's working group meeting. Good afternoon, ma'am.
Wow, thank you for that introduction, Jeff. It's so good to be here. Yes, I feel like I'm back home. We really do appreciate the opportunity. We'll take our 5 or 6 minutes and we'll be done. It's always nice to see names and faces. So Dave, good to see you, Dave Roddenberry. Victor, I see, and Blake, and wow, it does feel like coming home. I want to thank you for the opportunity, and I'm going to get right to it. We at NC for Me, as you know, started in really 2013 and 14 and rolled out live in 2015 out of the governor's office. We started with just an idea, but we have grown and we've gotten an amazing infrastructure in place. We've got a team. And today I want to take 30 seconds and introduce you to our new Director of Operations, Sean, if you would mind popping in.
Good afternoon, everyone. Sean Cox, Director of Operations for NC for Me. Retired last summer as a Sergeant Major for HMX-1 in Quantico, Virginia after 30 years. And now I'm living in Jacksonville, North Carolina, and just truly enjoying my opportunity to work for NC for me and Kimberly and all our great partners, such as the Governor's Working Group. So thank you for having me.
Thank you, Sean. I wanted to make sure everybody saw Sean because he's been really, truly directing all the operations for NC for me. You know, when we got involved with this, we did so because of two reasons, really. One is that one of the number one concerns for our transitioning service members when they leave the military is securing meaningful employment. We also know that the number one driver for economic development is talent. And obviously that gained the interest of our governor's office, because if we want to keep our talent, particularly high performing talent that exits the military in the state of North Carolina, then we need to make sure our employers are actively recruiting them and want to keep them in their organization. So if we want to drive economic development, we want to keep our talent. And if we want to help our transitioning service with one of their number one concerns, which is securing employment, we created NC for Me as a result of that. We started the program, as I said, out of the governor's office, but we have very strong relationships. Victor will tell you shortly, I know our strong relationship with the Department of Commerce, also with the Department of Military and Veterans Affairs, along with several other veteran service organizations like Veterans Bridge Home. And I know we've got Blake on the phone. We also partnered with some very, very kind corporate sponsors so that we could pull off this initiative. And it is very simple what NC for Me does. We do three things. We educate strategic leaders across the state on the value of bringing transitioning service members into their organization. We let them know that if they're not hiring our military talent, then their competition is. So we get them really excited about putting together a strategic initiative in their company to make sure they bring military talent into their organization. Then number two, we simply engage HR professionals, right? Because HR folks, I'm one of them, we're the gatekeepers for the jobs in any organization. So we became certified as a provider of accredited training across the state through the Society for Human Resource Management. We have 18 SHRM chapters in the state of North Carolina, and we educate SHRM professionals on the value of bringing transitioning service members, Guard and reservists, and veterans and military spouses into their organization. And then finally, we connect them through our hiring events. So if we'll go ahead and change the slide. So many of you might say, well, how do you do this? Well, it's very simple. 80% of most MOSs in our military organizations have a civilian counterpart. So many people can walk right out of the military into some great jobs across the state and really across the country. In the state of North Carolina, we have 20,000 transitioning service members that exit our bases every year because we are the fourth largest Department of Defense presence in the United States. So that's 20,000 folks that are coming out of the military that HR professionals are hungry for. Then we convince them of the value they bring to the organization. You add to that number our Guard and reservists and our veterans in the states, and then additionally our spouses, and we convince employers of the value and also the access. We also make sure they understand that this is a very diverse talent pool. And we show data to our employers that they can increase their retention rate, because one of the things we are concerned about as employers is our turnover rate, because it costs money for us to roll through people. So we know that our retention rate with our service members is much higher than their peers that do not have military experience. And we know also that one of the things they're concerned about is their bottom line. So we let them know that working with NC for Me is completely free to any organization in this state. So it decreases their recruitment costs. So that is the program. And if you'll change the slide, so then you might say, well, how have you done? Well, we've done pretty darn good, to be honest with you. Thanks to the support from the Department of Commerce, the Department of Military and Veterans Affairs, and our corporate sponsors, we have educated over 4,600 strategic leaders across this state. Now think about that. These are people that decide, are we going to put a strategic initiative into our organization that we are going to focus on military talent? We certainly have moved the needle. We have also educated over 1,100 HR professionals through accredited HR training, so they get continuing education credits for attending our courses. And then we have documented over 3,700 interviews. Of those, we know that 50% have either been offered a position or invited back for a second interview. So we have a 50% success rate at our hiring events. It's interesting because COVID, everyone talks about 2020 being a bad year. And I will tell you, it's been great for NC for me, because even though we were concerned about how we were going to pull this off, because every one of these things that I have told you are live events that we do, we have moved everything to a virtual platform. As a matter of fact, we are finding that we are much more effective, much more efficient, and much more economical. We call it our 3 E's with a virtual platform. So we have continued, we have done well, we've been extremely successful, and we're very excited about our new team members that have been on board and our continued focus to get transitioning service members, Guard and Reservists, veterans, and their spouses into meaningful employment across the state. Jeff, that's all I've got for you. And I know that Sean has or is or will be putting up our contact information in the chat line.
Kimberly, ma'am, thank you so very much. Always a pleasure. And thank you for the great work you do and your modesty. You know, I seem to remember that from 2014 to 2016, you were instrumental partners in us reducing veterans' unemployment by 50%.
That's right. Yeah. Thank you for recognizing the work we do. But I will tell you, it takes a team, and we have been very fortunate to partner. And I know you're about to hear from Blake with Veterans Bridge Home. And I will tell you, our strong partnership with Veterans Bridge Home is about to really move the needle over the next couple of years. We're very excited about that.
Well, we'll be excited to hear about that. Next up, we have Mr. Lane Dyer from the United States Department of Labor. He's our North Carolina director and man responsible for many of the good things y'all hear about today.
Thanks, Jeff. Everybody reading me loud and clear? Yeah, sound is good?
Yes, sir, I can hear you.
All right, great. So how do we fit into, here we go. So how do we fit into the Veteran Service universe here in North Carolina? It's the Veterans Employment Training Service. We're an agency within the U.S. Department of Labor. It's made up of veterans, so all of the staff in the field offices in each state are veterans. And we're primarily a funding source. We're focused entirely on veterans employment, and we bring grants and contracts into each state to help veterans go to work. North Carolina, our investment's about $10 million a year, and that goes for a number of different programs that you're going to hear about today. Let's go to the next slide. So here's how we break our mission out into these 4 pathways. So you can see prepare, provide, protect, promote. They work that out so it all comes out P. So that's really cute. But we're talking about preparing. We're talking about what we do with transitioning assistance programs at our 5 military installations here in North Carolina. We're part of the TAP curriculum. We offer several classes that are focused on helping transitioning service members and their spouses get ready for civilian employment. Here in North Carolina, we did 322 workshops in fiscal year 2020. And that was about 6,860 plus service members went through there. It was a little slow last year because of the pandemic. I'd say this year it's really picking up. I was just looking at the numbers for January, and the month of January alone, we did 51 workshops for almost 1,500 transitioning service members in 1 month. Most of it is through virtual platforms right now. A couple of the installations are doing in-person classes, but the big ones like Fort Bragg and Camp Lejeune, they're doing only virtual right now. So that's prepare. When we're talking about provide, this is where the grant resources come into the state. Our biggest partner is NC Works, and you all know Victor. He's the director of the Jobs for Veterans State Grant Program here in North Carolina that we fund. Provides resources for 75 veteran service staff across the state, based in the NC Works offices that work with veterans, that work with employers who are interested in hiring veterans. They get out and promote the value of veterans as a great employee across the state. So we've got that. You're going to hear from some of our other grantees, our Homeless Veterans Reintegration Program, or HVRP program, which we have 4 of those here in the state. They're designed to help homeless veterans get back on their feet, get into employment, whether it's providing them with getting their car fixed or providing them with a pair of work boots or some clothes or some helping them get access to medical care, anything that's part of the process of getting them back into the workforce. So basically a case management program that works really intensively with them. But like I said, you're going to hear more about that from the grantees themselves. And also wanted to mention the stand downs. Thanks to Dr. Laws for bringing that up about the stand down event. That's represents about a $30,000 investment for us to provide funds to help go ahead and buy materials, meals, boots, sleeping bags, all kinds of things like that that will bring homeless veterans from wherever they're trying to survive to one place where they can get access to services. And now, thanks to the state, access to the COVID vaccine. But mainly, I see these events as a way to bring those people in and market all the services that are available to them to help them improve their lives. There's some great things going on in that provide pathway. Protect, that's the only place where we really provide a lot of direct services. That is our USERRA investigations. We're the agency that goes out and looks into complaints by service members and veterans that their employer has treated them differently because of their military service. Uniformed Services, Employment, and Reemployment Rights Act. We have a team of investigators in each state, and they do things like, in addition to investigate, they also mediate, try to arrange settlements. If all else fails, we refer the case to the Department of Justice, and where they can do criminal prosecutions in court if need be. But we rarely ever get to that point. We're good at mediating agreements between employers and service members. So the last little piece here is promote. That's what I'm doing today. We love to get out and collaborate, to talk to employers and business associations, groups like this, collaborate with our other partner organizations, just anything to get the word out on the value of veterans. You can see our website down at the bottom here, www.veterans.gov. All these programs are spelled out in great detail there. And I just want to say a few words about one more program. So next slide, please. Our Hire Vets Medallion Program. The website is hirevets.gov. This is a program created by Congress to recognize employers that are truly veteran friendly. There's a real need to recognize, promote, support, and honor these employers who run away to hire military veterans. And so this is the program that's designed to do that. The application period is open right now through April 30th. It's only open during this first quarter of the year, from the end of January until the end of April. I just want to encourage, if you are a veteran friendly business, especially small businesses that are veteran owned, this is a great opportunity to get some recognition. We partner with NCWorks to highlight these employers and their job openings within the system so that veterans can find them easily. So if you're looking to attract veterans as employees, this is a great way to do it. One more slide here, I think. Yeah, so here are some criteria. Obviously, I don't have time to go through all that, but mainly we're looking to see that a company is hiring veterans, that they're retaining veterans, and that they're providing some support to their veteran employees. Those are the basic criteria that's spelled out on this chart, which is on that website, hirevets.gov. You can actually apply for the award completely online. There's no need to send any paperwork in or anything like that. So as I said, it's a great program, and I hope that North Carolina has had good results with getting employers recognized, and I hope we get a lot more this year. And if you're listening out there today, you've got until April 30th, and please apply for this recognition, which will be good for you and will be good for veterans. And then I just want to wrap up with my final slide and say, got one more? Yeah, so here's the way you should think of the Hire Vets Medallion Award. It's a seal of approval. It's like Good Housekeeping, Underwriter Laboratories, J.D. Power, all these things we're used to seeing, that someone in a position of authority is saying that you are worthy. And in this case, it's the federal government saying that an employer is worthy of being recognized as veteran friendly. So thanks for the chance to speak, and looking forward to hearing from some of our partners. So thank you, Jim.
Thanks so very much, Lane. And I'm glad you explained that last slide. I was thinking that you got Car of the Year. Next up, we've had some of Lane's partners from local groups here in North Carolina that do the real work on the ground here. I know we've got Jessica Rice sitting in for us from ABCCM. We've got Allison Card from Volunteers of America and Perry Comer. So if y'all would like to take it away.
All right. So thank you so much for having me today. I'm Allie Card with Volunteers of America, Chesapeake and Carolinas. We are one of the organizations that receives an HVRP grant from DOL. So I just wanted to give a short overview of our program, and apologies, it looks like our slide is a little difficult to see here, but we serve veterans who are experiencing homelessness and are looking to get back into employment and a career path. So here's just our basic eligibility. Our grant is specifically designed to serve female veterans as well as veterans with families, so with a dependent. So if it's a male veteran, they do have to have a dependent under the age of 18. We serve veterans, and then again, I went through that eligibility, and we also are really focused on folks who are experiencing homelessness or are at risk of homelessness. So we do serve folks who have experienced homelessness within the past 60 days, but are now housed. We are also working with folks who are receiving additional supportive services such as SSVF or HUD-VASH, additional partners, GPD, and are seeking services from HVRP. We also do serve folks who are at risk of homelessness. So that is kind of on a case-by-case basis. And we serve anybody who is seeking services around employment and getting back into a career. Next slide, please. Here's just an overview of the service area that we serve through HVRP. We have 3 employment specialists, one in Durham, one in Wake County, and then one in Fayetteville. So here it just shows the 31 counties that our HVRP grant covers across the state. Next slide. Just wanted to highlight a little bit of our outcomes over the past grant year. So our program year 19 outcomes, we served 109 veterans, 48 were male, 61 were female. 72% of the veterans we served participated in some type of training opportunity that prepared them for a career. And then 61 or 56% were placed in employment, and our average hourly wage was $13 an hour. So we really are looking to place veterans not just in minimum wage jobs where they'll be, really working paycheck to paycheck to be able to afford housing, etc., but really trying to have a family sustaining employment and salary so that they're able to get housed and remain stable. Next slide. And here are our outcomes so far after the second quarter of this program year. We've served 34 veterans, 11 males and 23 females. 47% participated in training, 16 have been placed in employment thus far, and our average hourly wage is $15.30. We'll talk a little bit more, I'll speak with Curry a little bit more about some of our struggles this year, but you can definitely tell that halfway through the year, our numbers are a bit lower, and we'll get into kind of the details of that. And then I just have my details here if anybody wants to reach out, and you'll hear from me a little bit more.
Allie, thank you so very much, ma'am. Next up, our friends from Veteran Services of the Carolinas.
Hey, good afternoon, everybody. I'm Curry Cromer. I'm the Assistant Director for Employment and Training for Veteran Services of the Carolinas. I oversee each of our three HVRP programs across the state. As we go to the next slide, you'll see we have 3 programs across the North Carolina, our West, Piedmont, and East grants, respectively. we cover almost half of North Carolina's 100 counties. And I think if we overlaid VOA's program, we'd see that most of the state is covered. One thing that we do to serve such a large area is we have our case managers strategically placed to live in the areas they serve. So we're able to maximize the veterans that we can reach. Next slide. Here's a quick look at our program outcomes from last program year. So the program runs from, this is from July 1st, 2019 through June 30th of 2020. Our combined, with all three programs, we were able to enroll 309 veterans. We placed 115 of those into employment at an average wage of $12.86 an hour. And so you can see those job placements were definitely lower than we anticipated, and we definitely felt some challenges with COVID-19. We continue to feel those, but it's important, I think, to think about when we look at these numbers, that these are real lives that are being transformed. So if you look to the right of the slide, this is a veteran named Elizabeth who asked us to share her story. And Elizabeth was an Air Force veteran. When we met her, she was residing in her vehicle. We were able to connect her to the Supportive Services for Veteran Families program. It was able to house her in an emergency hotel and then later into permanent housing. And as Elizabeth progressed through, we entered her into the Homeless Veterans Reintegration Program and assisted her with truck driving school. So here's a picture of her having just received her CDL license. And Elizabeth was actually talking to one of our staff members earlier today. So she's somewhere out in Tennessee on a big rig and doing really, really well. So as you go to the next slide, here's our employment statistics through program year 2020. So this started on July 1st. We are approaching 3/4 of the way through the year. We've served a total of 251 veterans to date. We've placed 47 of those into jobs at an average wage of $14.46 an hour. And you'll see a picture of Jarrell here. Jarrell is another veteran who asked us to share his story. Jarrell was in our program year 2019. He was an electrician by trade. He'd hit some hard times, and we were able to come in with a host of support services through HVRP. We assisted him with some work tools. We connected him to our partners at JVSG to help with his resume and job search. And so Jarrell was able to identify some work as an electrician, but he didn't have transportation. And so through the HVRP program, we were able to arrange for Ubers. We were able to support him with Uber until he got his first couple paychecks under his belt and was able to take over from there. But he secured a job as an electrician, making $20 an hour with full benefits, and is just doing very well right now. As we go to the next slide. Here's our contact information. Please reach out to us if you have veterans that need these services. Send them through NC Serves, use the website, use the phone number, whatever way works best. And next slide. We do have some shared challenges that we just wanted to share with the group that we've experienced over the past year with the pandemic. We'll turn it over back to Allie.
Yeah, thanks, Curry. It's so encouraging to hear those stories of veterans. That's why we're in this work and why we do what we do. So you can see here by the sign, sorry, we're closed due to COVID-19, not to use COVID as a crutch for any reason about our work, but we definitely have faced some different challenges this year due to the pandemic. So we have faced some outreach constraints. Oftentimes our HVRP employment specialists are going out to shelters, they are going out to the street, they're going out to different service providers in order to enroll folks and do outreach, because we know that folks experiencing homelessness often do not have access or the normal kind of ways of communicating with the outside world. So we are physically present with folks doing outreach. And this year, it's definitely been impacted. So we haven't been able to outreach to employers quite as much or in the same way. And then obviously our veterans have been tougher to reach, as well as community partners. A lot of the shelters for a while were, kind of completely shut down and maybe putting people up in hotels. SSVF continues to put folks in hotels, and even now, our shelter systems are at 50% capacity or less. So we aren't quite able to do the same robust outreach efforts that we've been able to do in the past.
Yeah, and where we've seen some of our program outcomes impacted by those outreach constraints, we've also felt some impact to staffing issues, whether it's some staffing turnover, or several of our staff had actually contracted COVID-19 in 3 discrete cases. Fortunate that we're thankful that those staff members were able to make a full recovery, and we're also thankful that we had good social distancing and PPE in place so that those cases were not transmitted to other staff members, or more importantly, our clients who are most vulnerable.
And moving on to eligibility, one kind of glimmer of hope, I would say. Initially, up until a couple of months ago, I think, January, we were required to have our veterans provide their DD-214 in order to show their eligibility, because we serve veterans who are honorably or other than dishonorably discharged. So we were needing those DD-214s, and due to the pandemic, the time in which veterans could receive their DD-214 was greatly impacted. So thankfully, DOL came out with some guidance around being able to provide different documentation to show that eligibility. So we can use squares or a HINC in order to show a veteran's eligibility for our services, which has been super helpful. And then just another piece to the whole eligibility struggles. Thankfully, we have an eviction moratorium, which has kept so many people housed throughout this pandemic. And we know that people have been just economically destroyed because of this situation. So we're grateful that people have been able to remain housed. We, however, for eligibility with HVRP, it becomes a little bit more gray in the area of what it means to be at risk of homelessness, when folks might be, 6-8 months behind in rent, but are they really at risk in this moment? So in order to be eligible, they do have to have that at risk or be currently homeless. So there's just been kind of some struggles when it comes to that eligibility and being able to serve our veterans who really are at risk of homelessness.
And then also,
Allie,
go ahead.
Thanks so much, guys. Homelessness, we're going to get to that in a few minutes. So if you don't mind, I'm going to jump over to Mr. Blake Bourne to talk about veterans employment programs. And as soon as he zips through his, we'll be back to you guys for homelessness.
Okay.
Thank you so very much for your patience. We've got a packed full agenda today, and I want to make sure we get everybody in on all their points. Blake, are you with us, sir?
Absolutely. Hey, Jeff. Awesome. Thanks, Jeff. Hey, I just wanted to give you a quick snapshot. Veterans Bridge Home, feel like we're in good company with another three-lettered V organization. So shout out to VOA and VSC. I like the naming convention. We've been in the employment space for a few years now. I just wanted to point out a few things. The V-Start tool from our friends at Syracuse is an awesome way to get a real-time data that aggregates VA, labor, commerce. Everybody pulls it all together. Two things I wanted to call out here. There's 12,000 unemployed veterans right now in the state of North Carolina, according to this tool, and 7% unemployment for our 18 to 34-year-olds. That's something we got to do. We got to really focus on, because as we all know, that's a major risk factor when it comes to suicide. So those two things are really our sort of North Star in this effort. Something else to call out, that 10% female veterans in the state. If you look back at that data that Dave Roddenberry shared from NC Serves, recently we've seen 25% of the requests that have come into the network are from female veterans. So specifically, or pretty disproportionate number of almost double, 2.5 times the representation there. So some interesting stuff as we bounce off these big picture statistics for what happens on the ground. So encourage you to check MSV Start tool. Next slide. A little bit of context. We were launched in 2011 as then Charlotte Bridge Home, and quickly did an environmental assessment. It's linked here in the chat, or in the hyperlink there. Coming home assessment shows what the 2 priorities were that Charlotte at the time set for this community, and the number 1 was connecting veterans to employment. And we've been maintained focus on that from day 1, and have grown that idea on paper about launching a business coalition to now have an employer alliance primarily focused in the Charlotte area, with 250 plus companies. So that's 1/3 of our overall programming, and the one I'm going to focus on today. Next slide. So we adopted this employment continuum thanks to our friends at Syracuse, and then also we worked with the Disney's Veterans Institute back then, looking at those 4 key areas, and really making sure that the employers that say they're going to hire veterans are doing the things that are listed here. So we've taken that to heart and implemented it in how we engage and communicate and educate our employer partners. But we recognize that it takes really both sides. So next slide. I want to say thanks to Kimberly and Sean. Great to see you both, our friends at NC for Me. What we realized was, we've had a good idea. We've been doing great work in Charlotte. That's been our primary focus, and until just recently, with the expansion into the NC network, we really didn't have a reason or a need to be in those other networks because we had other great partners. And we started kind of assessing where we were and comparing notes and working closely with Kimberly at NC for Me, and realized that list on the left of how we both educate and consult with employers was very similar. So, the old Army adage, smarter, not harder. Why not work with great folks like them and, divide and conquer in how we do this. So we're really excited about that opportunity. For those that are familiar, you've seen us work together for about a year now on different things. And I'll touch on some of the specifics here in a moment. But we really feel like that side of the employer equation has to happen, right? Because veterans are going to go to those talent acquisition websites, hey, how do I find a job? And if the HR teams aren't prepared, then our veterans are going to be at a disadvantage. And then on the right-hand side, obviously we partner with our DevOps and our local partners like Goodwill, but one specific I want to call out is Patriots Path. Noelle and her team do a phenomenal job in preparing individual veterans and work on the veteran side of the equation. And then we bring that all together, right? Collectively, we find the right hiring events, the right networking events, and then do different types of matching over the years so that you can have both sides of the equation working towards each other, rather than one side doing all the heavy lifting. So we're excited that we've done this work. And next slide, please. I can show you some of the impact. So I recognize this is busy. It's meant to live on the Governor's Working Group website. So I encourage you to go back and check it out. On the right-hand side, you've got some pictures from some of the hiring events we had done in 2018 and 19. We've partnered in 2018 with the NASCAR Hall of Fame, 2019 with the Hornets at their arena. And then last year, we had planned to do an in-person at Bank of America Stadium with the Panthers. We're going to do a virtual one this spring, and then fingers crossed, an in-person one in the fall. But we love to engage those big local partners who can be another draw for our veterans. So this is a snapshot of just the last 3 years of impact. We really have had one staff member applied, to this work. So Paul Bill, our employment director, recently after 3.5 years, left and got a great job at a corporate partner. So we can't complain too much. Happy for him. We are hiring for that role. But in 2018, we had 806 folks reach out for help. We were able to support and place about 115. And then as you see, we slowly increased to 2019 with 336 placements. And then of course, last year with the pandemic, that number had a downturn. But overall, 25%, given that that's like I said, it's been a one-man band with Paul's work, not too bad. because the majority of his focus have been on those employers, right? The 265 total, he's built that over the years, and 493 different HR contacts companies. And like I said, that's just Charlotte. So before we stepped into these new markets, we realized we should work with NC for Me even deeper and even more. And as Kimberly alluded to, we're excited about what that opportunity will provide. And then it jumps into some of the hiring events and employer training data that we've done over the years. So these are preliminary numbers. We know we can get better. We need to do a better job of going even a step further in our measurement and evaluation of these. But really excited. If you can see, even with the pandemic, 2020 was a big year. A lot of that is thanks to that partnership with NC for Me. So, and then I put a little quote down here from one of our employer partners and then a veteran job seeker from 2019's September 11th event. Because obviously if we're doing the right thing, that it should come out from their voices, right, in their experiences. And I thought those two quotes captured that. Next slide. And then just wanted to give you a highlight. These are some of the best employer partners we have in the Charlotte market. This, of course, isn't all of them, but these are the ones that we've really worked closely with, have been with us for a long time, and have stepped up in a variety of ways. So we encourage more companies to reach out. We're excited to do more, and we're excited to figure out together with NC for Me how to expand on this impact from Charlotte in the Triad, the Triangle, and Fayetteville. I do have a vignette I want to share that's part housing and part employment, but I'm going to save that for our housing portion of the brief. And I'll drop my information in the chat, and feel free to reach out anytime. Thanks.
Blake, thank you so very much, sir. And a lot of activity in Charlotte and years worth of hard work. Folks, please go look at the presentation on the website and take some time to study it. Next up, we're going to talk about housing programs. We kind of put this little slide together, modified from some work that the folks at the Coalition on Homelessness did, try and paint a picture of not only the programs, which we've kind of listed on the left, but some of their other partners that we put through here to help give some context to the really confusing world of veterans homelessness. So on that note, we're going to go right back to Blake, and the floor is yours, sir.
Thank you. I appreciate the parody. Let me go first after going last. This is great. Hey, I got you another really busy slide here, but felt like it was a great way just to demonstrate some of what's going on in the housing space in Charlotte. You know, for those that are fans of General McChrystal or been in the Army, you know, the assess, align, and act model, we've tweaked that a little bit, identify, align, and innovate, because that's really some of the recent efforts we've had in Charlotte in the housing and homelessness space. So on the left-hand side, you know, we work very closely with our COC. North Carolina 505, Charlotte's continuum of care has been great, but the reality is right now there's 256 veterans on that list. That's updated as of yesterday, and it's 12 up since January. So no surprise to this audience, but it's a number that we still need to maintain our focus on. When I joined this work 7 years ago, that number was north of 500. So it's great to see it come down, but we had it down to 137 and, you know, pre-pandemic about a year and a half ago. And it's of course climbed back up. So a lot of work to do. You couple that with the 1,600 requests that our network got for housing for NC Serves. It's a lot of need, right? Those are families that aren't just homeless, but you know, are at risk of being homeless or are, you know, on the border. So we got to step up, and proud of the work that our partners do, and proud Thomas Jacobs on our team co-chairs the Housing Our Heroes, which is the subcommittee of the COC focused on veterans. So that's the baseline, right? Identify, use the by name list, use HMIS and NC Serves, and then assess as a community, and then aligning the right resources, right? SSVF, we're a subcontractor with Catholic Charities, partnering with them, doing 201 outreach events in 2020. We screened 615 veterans and found 269 which are eligible. 37 were housed, and the remainder, of course, were in the hotels just because of the affordable housing challenges that we have in our urban environment. And specifically, I think the most important thing we do is align partners. And I want to give a shout out to VSC here in a moment. So I'm going to come back and tell you about that vignette. But the third thing is innovate. We've had an awesome opportunity for the last 3 years to work with Community Solutions. It's a national nonprofit that provides technical assistance in the housing space. They have the Built for Zero campaign. So we're one of 80 communities in the country that are doing this work. And we found out later last year that there was flexible funding available. So Mecklenburg County and Veterans Bridge Home were selected through a process of the COC to receive that funding that is meant to go directly to veterans, address gaps in services, pay for things that SSVF can't pay for or any of the other programs, and really get creative in how we wrap around those services to expedite those placements and reduce inflow. So we're excited about that. That funding just landed recently, and our team does an amazing job of working in the community to get that to the right veterans that are in the most need. But specifically to that, there's a veteran I want to call out and just show that alignment, as I mentioned. So we've been working with Catholic Charities, found a gentleman who was eligible. We got him into a hotel, got him off the street, safe, away from socially distant. And then we were working through some employment needs. Curry, a Veteran Service of the Carolinas, worked with Diane Weekly. They all came together and worked. So you've got Catholic Charities, Veterans Bridge Home, and Veteran Service of the Carolinas all working together to make sure that these goals are met. We pulled in our friends of the DVOP locally in Charlotte. Then through HVRP, they were able to purchase some work clothes and work boots so you could get started as a driver. But there were some court fees and driver's license issues that then we were able to use that Built for Zero funding to address. Then Catholic Charities, through their case management of SSVF, wrote a sustainability plan and made sure they were working to get their car repair paid for. And then we had to, we made a referral and did some more wraparound services with the Charlotte Center for Legal Advocacy to work on a discharge upgrade so you could access more benefits, beyond. So you've got housing, financial assistance, employment, and legal all working together for one to set a family. And he started his job on February 8th, and he's driving for a healthcare company right now. So just an example of the effort that it takes locally to align the right resources and then utilize all of them to their best first use for the right outcome for a family. So proud of the work our community's done. None of that happens without great partnerships and a lot of communication. But we feel like there's a lot of progress that has happened in the Charlotte market, and we're excited to take that forward. Thanks.
Thank you so much, sir. And you and I will follow up because Charlotte market was the subject of much of the conversation today at Operation Home. I think you've got a bunch of national partners that are also looking to lean in and help in this area. Next up, we are delighted to welcome back Allie Card from Volunteers of America, Chesapeake and Carolinas Division to talk about some of their housing programs.
Sure. So kind of jumping back in here, we've got a few different programs that we provide veterans, and we have a very large SSVF program. We operate in 61 different counties, and we have 4 different offices. We have GPD Maple Court, which is a 24-unit GPD transitional housing program where we provide bridge, housing, and hospital to home. And then we also are one of I think 127 grantees for the new pilot GPD case management program. So this program, we have a case manager in both Durham and in Fayetteville, and they are focusing on housing stabilization for our veterans. Next slide. This is just a map of our SSVF that we cover and where our 4 offices are. We served 989 households during the program year 2020. Next slide. Here's a picture of Maple Court. That's where my office is. I'm a senior program director, so I oversee Maple Court in addition to HVRP. And we have 24 single units where we're serving veterans. It's a 3 to 6 month stay, and we served 52 veterans in 2020. Next slide. And just briefly, our GPD case management program, as I mentioned, we are out of Durham and Fayetteville, focusing on housing stabilization, getting folks connected to community resources. And we are grateful because this program is going to be able to start partnering with HUD-VASH as well. So we'll be getting some additional referrals for folks who are seeking housing, and we're just excited to be able to provide that housing stabilization for folks.
Thank you so very much, Allie. And Veteran Services, the Carolinas.
That would be me. I'm Jessica Rice. I'm the Assistant Director for Housing Program, Supportive Services for Veteran Families. Next slide. So Supportive Services for Veteran Families, the same grant that VOA was just discussing, is a homeless prevention program, some basic eligibility. It's veterans and their family members. It is a low income program, individuals under 50% of the AMI for HUD, and veterans has to be located in that household. We're looking for individuals that are either at risk of losing their housing, either facing eviction or behind on their rental payments, or the individuals that are already literally homeless, and that includes people staying in cars, on the street, or in shelters. We're able to offer case management and housing search assistance, and that along with the financials of paying for moving into new housing or sustaining housing as well, which would include rental assistance and deposits. Next slide. This is our coverage area. We cover 28 counties in Western North Carolina with the SSVF grant. We have 2 offices, one in Mecklenburg and one in Buncombe County. We were very fortunate that when COVID and all the quarantining and everything with the pandemic hit, we were already fairly well equipped for this type of work. We have a lot of case managers that are out in the field. We say working remote, but we mean in the community, not just in home offices. So it worked well for us. We were able to, most of our processes were pretty well defined for this type of work, but we were able to make it safe and utilize our case managers that were already out in the field. Next slide. We have an 88% housing success rate. We're able to move individuals into housing rather quickly. We had 754 veterans that were screened with our 2020 last year. One thing that we've actually done to reduce that number is we saw that we were screening individuals that weren't eligible for the program, and then what do you do with them for next steps? How do you find the right fit or a good program for them? With the introduction of our NC Serves team, we were able to reduce that by 20% already. So we're seeing a decrease in the individuals that we're having to screen for the program because they're meeting with their appropriate interventions sooner. 372 of those veteran families were enrolled, and like I said, 287 were housed. We did see a decent split of those individuals being literally homeless, rapid rehousing cases, 186 of those, and then those homeless prevention cases, the facing eviction or late notices of the same 186. Next slide, please. A big part of COVID and the CARES funding that we received was this emergency housing assistance, also known as EHA. We were able to hire a coordinator that coordinated with hotels and created relationships with hotels in our catchment area. That really gave us tools that we were able to move individuals in and out of hotels quickly and efficiently. And it did a huge lift on the billing portion for our case managers, which was taking up a decent bit of time when we first introduced this. We were maxing credit cards left and right. There's a lot of paperwork involved with those direct bills. So to be able to hire an individual to do that was huge. We had 53 veterans that were housed out of our emergency housing program. We have 12 of them that are still open in the program, not necessarily in hotels still, but they're still enrolled with SSVF, and then 10 for noncompliance. I know everyone sees it there, that little one there with the other, and everyone's probably like, what does that mean? And I don't want to leave it unanswered for you. We did unfortunately have a veteran that passed away in one of our hotels. I will say that, I always try to see the silver lining in things, and we were able to get him off the street. He probably would have passed much sooner outside if we hadn't been able to get him into emergency housing. So that was one life that was definitely affected. He was actually loved by the individuals at the hotel and the front desk. They really surrounded him with a lot of care, and he unfortunately passed away due to cancer. So out of control. The length of stay for EHA, we kind of try to keep that around the 45-day mark through SSVF guidance. We realized with COVID and the closing of shelters and just the lack of resources that was a little bit longer. So we did have individuals that when we started this program, we pulled them off of the street rather quickly. And then we realized that there were more barriers and they were going to need to be in the hotels more than 45 days. So we do see that, we've gotten that down. We're right around the 30-day mark with 41 of our individuals. And that'll be something that we continue to monitor as COVID changes and as housing becomes available for those individuals. Next slide. Two really quick little points on our residential program. So in Buncombe County, we offer 2 shelter options. The Veterans Restoration Quarter, which is a 250-bed men's facility, 158 of those which are grant per diem. That is a revolving door with COVID and some of the regulations that were put in place. There's quarantine rooms and different things happening there, but it's still very much open and functioning. The next one would be our Transformation Village. So opening a shelter during COVID is probably not something that you want to do and not recommended, but it was something that needed to be done. That facility was brand new, being built and got finished, and we had to open it. So we have 90 beds there, and 15 of those are the grant per diem beds for female veterans. It's a huge resource in this part of the state for families and women with children. We had a wait list at our previous shelter that was a decent bit smaller of over 300 individuals. So being able to move and flex with the need is something huge that we were able to do this last year. Next slide. And that is it for us. That's our contact number for our coordination center and our website. I'll drop my personal email in the chat if anybody has any questions directly for me. And that'll be it. Thank you.
Jessica, thank you so much. Always great to see you. And thank you for all the hard work you've been doing across the state. I hear about it daily.
Perfect.
Next
Thank
up,
you, Jeff.
we have folks from the VA who are going to talk to us about all of these programs. I don't believe Brian was able to join us. I think he had a conflict come up this afternoon. So if we can have our VA representative jump up and get to our next slide there. Alex. Hello. All right, we're having a little bit of a problem here with the VA, getting them linked up. Like, Colonel Falls said, there's lots and lots of meetings and things going on today. So, Alex, if we can go through this. Yes.
It looks like Brian's there. He's trying to talk to you, but he's on mute.
Ah, Brian. I think we're having some technical difficulties. Alex, can you unmute Brian?
No, I'm asking him to unmute, but he may have stepped away.
Yeah.
All right. Well, we've got about 10 minutes left and a number of slides here. Let's go through some of these slides here. Toya Burgess, are you with us? Hello. All right.
No, Brian let me know that he would be joining us, so I don't think that she's on today.
Okay, well, I think we're having some technical difficulties here.
Hey, can you hear me?
There we go. There's Brian.
All right, finally.
Thank you so much, sir. The floor is yours.
All right, thank you. And I can hear an echo. I don't know if you can hear that.
You're coming through wonderfully on my end, sir.
All right, I'll go ahead. So I'll start off by acknowledging that most of our partners
Brian, I think we've lost you, sir. We're having a challenge with the audio here.
It looks like he's muted again.
Let me try again. Can you hear me?
Got it. Yeah.
Hello?
Hello?
Yeah,
You
you're
got it.
great. We can hear you fine, Brian.
All right. Are you sure it's not you, Jeff, trying to sabotage my presentation?
Oh, I'm 100% sure.
Okay. All right. So I just wanted to say that the VA is committed to the goal of preventing and ending homelessness. The ultimate goal is to make sure that every veteran has permanent, sustainable housing with access to high quality healthcare and other supportive services, and that veteran homelessness in the future is prevented whenever possible or is otherwise rare, brief, and non-reoccurring. VA and our federal, state, and local partners, as well as non-governmental partners, recognize that ending veteran homelessness is not a single event in time. Rather, it's a deliberate effort to achieve the goal and continued follow-up efforts to make sure that progress toward achieving the goal is maintained. Let me see if you want me to touch on SSVF, or because of the sake of time, the only thing I could mention though is that the VA works very closely with multiple organizations, including United Way of Forsyth County, which covers the coverage area from Salisbury VA, including Davidson County and the rest. Passage Homes Incorporated, which covers Wake County, Homeward Bound of Western North Carolina, which covers Buncombe County, Asheville, Buncombe Community Christian Ministry, which I think are here today. I think Brandon is here, which covers multiple counties and covers both Asheville and Salisbury VA coverage areas. Catholic Charities Diocese of Charlotte covers Mecklenburg County and Salisbury VA. Volunteers of America of the Carolinas Incorporated, which I think Ms. Card was talking about. And I'm very pleased to hear about the new opportunity for SSVF and Grandpa Diem and Hardvash to work together. Next slide, please. Grandpa Diem program is a program that allows VA to award grants to community-based agencies to create transitional housing programs and offer per diem payments. The purpose of the program is to promote the development and provision of supportive housing and or related services with the goal of helping homeless veterans achieve residential stability, increase their skills levels and or income, and obtain greater determination. Grant and per diem programs funded projects offer communities a way to help homeless veterans by providing housing and other services, at the same time assist VA medical centers by augmenting or supplementing the care. And I think a good example is VOA in Durham. I have had the great privilege of actually working directly with veterans in my previous role, veterans who were enrolled in VOA, and one of the best, probably best programs is the one at VOA in Durham. So great work. Next slide, please. Hardvash. I think this is probably one of the most effective permanent supportive housing programs in the country. Housing and Urban Development Veteran Supportive Housing is the full name of the program itself. This is a very unique collaboration between the U.S. Department of Housing and Urban Development, as I mentioned, and the VA. HUD provides eligible homeless veterans with a housing choice rental voucher. And in return, the VA provides clinical case management and supportive services. I think that's a very important distinction to make. I think sometimes it can get a little confusing, but I just wanted to emphasize that the VA provides the supportive services, case management, and the wraparound services, and linkage to other organizations. Veterans can gain housing stability and recover from physical and mental health problems, substance abuse or use disorders, and other issues contributing to or resulting from homelessness. HADVASH subscribes to the principles of Housing First model of care. Housing First is an evidence-based practice model demonstrating that rapidly moving individuals into housing and then wrapping supportive services around them as needed. This helps homeless veterans exit homelessness and achieve housing stability, improving their ability and motivation to engage in treatment. The program goals are to help veterans and their families gain stable housing while promoting full recovery and independence in their community. We know that with the pandemic, I know we've mentioned before these previous presentations, and the eviction moratorium, we've seen a lot of veterans remain housed, but we've also seen those veterans trying to get housing face a lot of challenges because of the housing stocks. And I've seen a reversal in the total number of veterans housed between different catchment areas. For instance, I'm going to give you an example. Asheville, in previous years prior to the pandemic, they used to struggle a lot with the housing stock and utilizing their HADVASH vouchers. With the pandemic, surprisingly enough, they're doing very well utilizing their vouchers. In fact, right now, I think they only have 3 vouchers available for use. And that's a testament to the work that happens in that community. And I just want to take this opportunity to thank Brandon and the other organizations that support veterans up there. You know, they have the largest Grand Per Diem program up there, and they've done a great job working with the VA to help those veterans. The Triangle area, in the past, they've done relatively well, even though it's becoming very competitive. Everyone would like to live in the Triangle area, and the housing stock is getting really small. And with the eviction moratorium, that's been even more difficult. But one thing we are observing is something positive happening. A lot of HADVASH veterans in the Triangle area are qualifying for additional sources of income and benefits and graduating from HADVASH. So there's a part of the story that's not really celebrated as much, but the goal of recovery is for folks to return to where they were before they needed the services and the resources. And we are seeing, especially in the Triangle area, a lot of veterans moving back to a place where they don't need the HADVASH support and the voucher. So going forward, I think we will benefit a lot from working together, collaborating to build the capacity of the community to provide permanent housing, because that's the ultimate goal. And with that, I have finished my presentation, and if you have any questions, please go ahead.
Brian, thank you so very much, sir. You know,
You're welcome.
I don't think most people realize that you've probably got the toughest job in North Carolina and Virginia.
But I have your support, sir, and the support of the community. So we'll do it together.
Thank you so very much, everyone. We have had a jam-packed governor's working group. As always, thank you for your efforts and your participation. Yes, sir.
If I may,
Please.
Secretary Gaskin is with us. He joined us about the time that Blake was doing his presentation, and he has listened into that part, but he'd been on that as I said, that Codell meeting for quite some time, but he was able, he ran upstairs, he's on with us now. And so, Secretary, if there's anything you'd like to say.
Just 2 things. First of all, thank you for what you do. Everything that I heard was collaboration, join us for all that you can do for the veterans and their families. And I am very proud to be a part of the team that does that. And so I just want to be able to thank you personally for what you do, what I've heard, and what the potential and expectations that will happen throughout North Carolina. Thank you very much.
Hoorah, sir. Thank you so much.
Hoorah.
All right, everyone, please have a wonderful and safe afternoon. As Colonel Falls suggested, to go out and stare at the orb in the sky, not too closely though. Thank you, everyone, for all the great work you do, and we will look forward to seeing you virtually next month.
Thank you for having us.
Thank you very much, ma'am. Goodbye, everyone.
Bye, everyone.
Blake.